thank you so much for joining us and joining WithMerci in doing this and educating so many around the world. That's our responsibility here. It is just an awesome blessing just to have each one of you be able to be a voice for so many, especially during this time. You guys are in, with Apraxia Awareness Month and being advocates for that. It's very important that we get this message out. And I thank you for allowing me to be a conduit for you guys in order to really push this message as well too. Look, I'm looking a little rough right now, so just believe me, I need a whole lot of editing.
Clean that up.
So my name is Whitney Mercilus. I am the founder and president of the WithMerci Foundation. It is Apraxia Awareness Month. I will give you guys the floor in order to introduce yourselves.
My name's Miaya Allen, and I'm a speech language pathologist. I've been doing this about 14 years now, and I've been working with Easterseals of Greater Houston probably over 10 years. I specialize in pediatrics. I've done pediatrics my entire profession, and I've done a variety of settings from early childhood intervention, home-based, outpatient clinic, and school-based services.
My name is Jordan. I'm 23 years old. I run a blog called Fighting for My Voice, My Life with Verbal Apraxia. I am also an advocate for apraxia and also for mental health as well. And I also am a college student as well, getting his bachelor's in psychology. I've been advocating now for, it's going to be a year on May 21st.
My name's Heather Emmons, and this is my son Christopher. He is 14 years old. I had always intended to work with kids with special needs. I was actually pursuing a PhD to do especially work with nonverbal children with autism. And we were planning to adopt, my husband and I were planning to adopt children with special needs, and then God threw us a curveball and said, here, have some of your own. So we launched into this really interesting adventure, and it's kept us very busy and moved us to Houston. I actually had the pleasure of working for Easterseals for a year, which was fantastic. But I'm not able to work right now because taking care of Christopher and his brother and sister is a full-time job. So, yeah. And Christopher has now been getting speech therapy through Easterseals. From before it was Easterseals, it was United Cerebral Palsy. He was in the early intervention program as a 2-year-old when we moved to Houston, and he's 14 now, and he's been getting almost continuous speech therapy with Easterseals. So we love them.
That's awesome. We love them too, and we love partnering with them. And Christopher, hey, look, I love the hair swing. Okay, man, hey, let it fly, let it fly, man. I wish I had that. Well, we'll dive into the questions, and guys, look, this is just a conversation. This is what we are here for, to educate everybody. So I'll start off the questions. Look, I'll ask you guys, what is apraxia?
I do not know.
Do you guys want the therapist version of apraxia?
Let's do it. Let's go with that.
A synopsis overall is it's a motor speech disorder where it makes it, there's a mix-up between the message getting from the brain to the muscles in the mouth. And we don't know why. It's neurologically based. So generally a speech therapist diagnosis, but you can also have a pediatric neurologist or maybe a developmental pediatrician who specializes in different developmental disabilities could also diagnose. And I would say you usually get a diagnosis after 3. Before 3, it's kind of hard to differentiate what's going on developmentally.
That leads me to another question. So are you born with it or can you develop it?
So there are 2 different types when we are talking about apraxia. It is when we are talking about childhood apraxia of speech. we are talking about when the child is actually born with it. It is when we are talking about what is called acquired apraxia that can develop in adults due to a stroke or some other traumatic event as well. But the difference between those two is that with acquired apraxia, within time, that can actually go away, versus with childhood apraxia of speech, there is no cure, and it is a lifelong disorder that represents itself differently throughout the person's lifetime.
Okay. And both of you have childhood apraxia that has been developed since birth. Yep.
Yeah.
Are there any common misconceptions as far as what apraxia that, you know, people that you meet on a daily basis may take it for a wrong, misdiagnosis of what they may think that you have or whatnot? Can you guys elaborate on that?
There's a lot of misconceptions that people can have. There's a lot of different things when it comes to different diagnosis that they think that you might have. They might think that you have ASD, which has been a very common misconception that I have faced. People can also think that you are under the influence also of drugs or alcohol as well. And I have faced this from different people. I faced it from police when I got pulled over, and they've actually thought that I was either drunk or high. And that's when my mom I was like, oh no, he has this, blah, 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 which was very good that she, jumped on because that wouldn't be a good thing. But there's a lot of different misconceptions people can have because people's brains try to make sense of things that they don't get. So they try to jump to the first thing. So if you hear me talking kind of slow, or, my words are slurred, one of the first things that you are going to actually think is, is he high? But that's not the case. So yeah, there's a lot of different stuff. I could go on and on, but I'm going to stop there.
Yeah.
One of the biggest things that I see is that people are so entrenched in this belief that intelligence is tied to speech and that your speech represents your intelligence. And so there's just this automatic assumption from the vast majority of the public when they hear someone speaking slowly or hesitantly or struggling with their words, that it is a cognitive lack. And then that corresponds to, instead of talking directly to Christopher, they'll talk to me, or they will dumb down their language in a way that he doesn't need because his receptive language is fine. He understands what you're saying. And for most of his life, he has understood things, far more complicated sentences than what he could produce. And so it's always a challenge when we're in any new situation and with doctors and nurses in hospitals to make sure that people speak to him, because he is the person and the patient and the kid, when you want to speak to kids. So that's one of the big things that we have seen as a struggle.
Now, Chris, I got to ask you, how annoying is it when people do not look at you straight on and talk to you, instead wants to talk to your mom? How annoying is that?
Does it annoy you?
Oh, yeah.
A little.
As far as learning, being in the classrooms and stuff like that, how difficult is it for you? And also how difficult is it, to get that one-to-one teaching from your teachers, and also how is it interacting with, your peers and all that?
That's a really good question. That is a good question. It is actually, when I've been in college and such, and I've been trying to interact with peers and such, because I might have a speech disorder and stuff, but I am a very sociable person. I will talk your ear off if you're my pal or something. Like, my friends get so annoyed, but I am definitely a social person, so I've never tried to let it hold me back. But peers can sometimes they just don't know. It's when I meet a new person and when I tell them my actual name, and I'll say that my name is Jordan, and I break my name apart because it actually has 2 syllables in it. So it's kind of hard for me to say my name, which I joke around with my mom, and I'm like, really? You had to name me this name, but it's just a joke. People have kind of given me these odd looks, like, you can't say your own name and stuff. And I've actually had that actual comment made to me, or I've had comments made like, oh, did you have to think about your own name? And that's where I'll just be very open and honest and say, I have a speech disorder. And I have found that when I'm just open and I'm honest and I just own it, it actually puts the elephant out of the room, because there's no more questions in their mind. I'm just very honest, and I have also found that this has helped me just kind of also own this part of myself as well, and ultimately made me more confident as well with having a speech disorder.
That's awesome. How about you guys, Heather and Chris?
Do you remember when you were in school? When you went to school? That was a long time ago, huh? So Christopher went to PPCD, that's the public preschool for children with disabilities, starting at age 3. And he was in a special ed classroom until, I guess, middle of 1st grade or end of 1st grade is when we pulled him out and started homeschooling him. And so in that time that he was going to school, he unfortunately learned nothing and actually lost a lot of skills. He didn't start speaking words and sentences until he was over 5 years old. And when he did start speaking, he has a phonetic disability as well. And so his speech sounds, while we understand what he says now, because he's very consistent with the speech sounds that come out, the speech sounds that come out are different than what's expected. And so his family, we all understand him very well. And we've found that people who have a high degree of empathy understand him really well, but that's not everybody. And so there are some people who can be around him all the time and never pick up on his language. And so what we saw when he was going to public school, even though he was getting a lot of one-on-one attention, for various reasons, he changed schools several times. He changed speech therapists at school several times. And every time they'd try and evaluate him, I said, you can't give him an IQ test if nobody can understand his answers, So they were evaluating him and making these decisions based on basically him pointing at things and nodding. And that was the extent of their communication with him at school. So really, as soon as we pulled him out of school and we were able to engage in back and forth conversations all day, every day, his language really took off because he was missing out on all of that at school, unfortunately.
It's very frustrating when you don't have somebody, more people that are more understanding. Completely understand that completely. Maya, I haven't forgotten about you.
Oh no, I'm enjoying. Right. I'm listening.
I do want to ask you, how do you diagnose apraxia? How do you do that?
Good question.
Yeah.
Yeah, so it takes time. There are assessments that we can use. So usually when you come to a speech and language evaluation, we're going to determine if you have a communication disorder, right? And so speech is the actual sounds and words, okay? So like, for example, are you saying cat instead of pat, right? So that's the speech part. So that's its own assessment. And then we'll also assess you for language. And language receptively is what you understand, and expressively your words and sentences that you put together, okay? So to determine the apraxia, you kind of need to know all the pieces. Where is the breakdown? And sometimes that takes time. So essentially, because you can have just an expressive language disorder and maybe not apraxia, but me seeing you that first time, it's hard for me to differentiate. So really, when you come in, you'll probably present with some delays. And then as I get working with you, I'm able to better determine what speech patterns you have, where the disconnect is, and then more confidently, I can diagnose with apraxia speech. Because I think that even happened with Christopher. Once we, apraxia speech that's a long-term diagnosis. So we don't like to throw that around. So really, we want to make sure we get a good idea of the client we're working with and how to proceed from there.
How long is that time frame?
Every client's different.
Right.
It takes time because essentially we're connecting the messages from your brain to your mouth, and everyone's different. And every different treatment styles. I know for me, I've done training, it's called prompt to help, where I touch their face a lot to help them produce the sound. Sometimes it's just visually practicing it over and over. Even sometimes too, we'll see kids with apraxia, they have a hard time eating or feeding. And we just take things for granted, how easy it is for us, but it can be even broken down to feeding, where it's difficult for them to manipulate food or swallow safely. So it really just kind of depends on the severity. And if there's like comorbid factors, if they also, like I'll have kids with autism also have apraxia, or kids with Down syndrome can also have apraxia. So then that, that prognosis or their treatment will look different than if there's no intellectual things going on and it's just a motor base. So it really kind of depends on the client.
And I'll ask you too, as far as when was the first time you guys finally realized, well, I think we heard that Chris, it was around 3 years old that you guys found out that he had apraxia around that time? Or
I mean, like I said, he has a lot going on besides apraxia, and so that really complicates the diagnosis. We weren't sure why he wasn't talking, if it was a more fundamental language disorder, if he seemed to understand us, but then he's had a number of surgeries, and as you can hear, he has more than one speech issue as well. And he also had the oral motor swallowing issues and difficulties with feeding. So
he went
for him, I think it's been a much longer sort of evolving process of trying to figure out a way to help him improve his speech. And it's really been in the last few years that his communication has improved to the point where people out in the world can understand him without translation some of the time, which is enormous. I mean, it's so much better if he can go and run around a playground with other kids and I don't have to be near him translating for him, because No teenager wants their mom hanging around translating. That's just
Oh,
terrible.
you want to be an independent man. I know.
He's like, no.
When he was 12, we started talking about maybe he's got a tongue tie and he needs to maybe have that addressed. But if he had that addressed, it was going to be, there were concerns how that would affect his swallowing. And so it wasn't a light decision to look into that. And ultimately, you know, we left it to Christopher. This was the first surgery that we could say, you get to decide. Do you want to do this thing that might make it a little easier for people to understand you? Or do you want to just keep working with speech therapy and work extra hard? And he ultimately decided to participate in those oral motor stretching and letting Maya get into his mouth, which is something that he didn't want to do before that, and really practicing exercises of chaining syllables together and rehearsing those chains so that he could improve his multi-syllable words and his sentences instead of just single sounds. And and it worked, right? It paid off.
So I tell you something, guys.
Oh, you wanted to tell us something?
Yeah.
Oh yeah, go ahead. You got the floor.
So I, James, got the baby kid.
Yeah, the
Baby Tim?
chickens.
We
Baby
have
Tim?
baby chicks in our house now.
Oh, you got a baby.
And
Oh,
Tim.
cool.
Butter is curious about a kid.
Yeah, Butter is curious about the chicks.
And-
Butter is Christopher's cat.
Yeah.
How many
Man,
chicks you got?
1, 2, 3.
Mm-hmm.
Three
Baby
kids.
chicks.
And 1 week, how old are them? In 1
They're
week.
2 weeks.
2 weeks
Yeah.
away.
Do you remember their names?
Super,
Kuko
super,
and Goldie.
dog.
And then Gina Leland. April.
April. Yeah.
Probably next time we'll get a chance to see your chicks. Sorry.
Yeah.
Man, I'll keep it moving. I'll keep it
Yeah.
moving. I mean, I'll take a baby chick if you're willing to give it up.
They're pretty fun. I highly recommend it.
How much of a financial burden is it, with the diagnosis, the surgeries, the therapies, a different method of learning? How much of a financial burden is it for you guys as a family?
Just from the speech therapy
Mhm.
perspective, starting at age 5 or 6, Christopher qualified for a sort of a Medicaid waiver program. So now he has Medicaid secondary to private insurance. But my husband and I both have advanced degrees, and my husband has a very good job. I have not been able to work for most of our lives, and won't be able to work for the foreseeable future, because the year that I worked, the kids suffered. They didn't get as many therapies as they needed. There's just only so many hours in a day. And so the cost is one income, and we had really good private insurance. We've had really good private insurance all along. But I guess the best way to communicate how much of a financial burden this is, we were told to get a divorce on paper by multiple doctors and social workers, because we could not meet our children's needs. My husband actually had a great job and great insurance, and he sold plasma 3 times a week for a couple of years in order to pay for groceries, because all of our money went to copays and medicine. And even if you have a copay for speech therapy, even if your insurance does cover it, which many private insurances do not cover speech therapy, especially not for apraxia. For a child who's never spoken, they do not cover speech therapy. And so, we got speech therapy through early intervention for the first couple of years, and then we didn't have it again except through the school, which it's very different at a school than it is private. And we didn't have it again until he got Medicaid, because our private insurances at the time said unless he has this one diagnosis, he doesn't qualify for speech therapy. I'm like, do you want me to put him on the phone and you can, he can explain to you why he needs speech therapy? And it just didn't matter. No appeals process mattered. And then at the same time, the guilt as a parent that you can't do what you know that your child needs is just awful. We had a GI who said, well, he has to be in speech therapy 3 times a week. And I said, that's $500 a week. I don't have that. I can't just make that magically appear. So yeah, it's devastating to really have to fight those battles constantly with insurance, and to try and get, most people just give up, honestly.
Thank you for sharing that. As difficult as it is, and this is one of the things that a lot of people need to hear. A lot of people don't know the struggles as far as raising a child with disabilities, and how hard of a financial struggle it is. No matter how successful as a job that you may have, the kids need more attention. It's a full-time job, and the thing is, I want to help so much and so bad. And that's exactly why we're here, in order to push this thing along so that we can raise more capital, more money, in order to be able to donate and help families like you.
Good.
Jordan, well, what's your story? Tell us.
Well, I actually got speech through my school. So I went through my kindergarten year through my 6th grade year, and I actually did get that for free. But my mom, honestly, she was one of these moms that the school districts were terrified of, because she fought to the nail and the bone to get me what I needed and stuff. So I actually got speech for 7 years, 5 times a week, and including summers as well. And it is the actual school district would actually have meetings about my mom because my mom was on top of her game and she was making calls. So that's when I was young. We had really never had to worry about the money part, since the school did take care of it. But it is when I was 20, as I was actually having more struggles with my talking and such, because I had actually just then, I had just got a job, I had just went to college, and I was having like a whole bunch of more of these life events and stuff that they didn't prep me for as a kid, so I needed more help. So that's when I actually decided at age 20 to go back, and it's when I first went for my first session. Whenever I was 20, it costed $300 for just one session a week. And that's when I was like, this is a lot for one session. And this was only for like an hour. So it's actually what I ended up doing is that I began to get it covered through my college tuition, because as I actually attend a speech language pathologist that's at a university. So I am able to more so get it covered through that. But if I was not able to, it would end up costing me $300 a session. So it is definitely expensive. I have also heard of parents as well for my patient and such that, yeah, just like how the mom was saying that it's that their insurance will not cover it. And then it's also once these kids get to a certain age, so once they get around 14 or 15 or so, and they need it, but the term is called childhood apraxia. So it's when people hear that term, a very, very common misconception is that, oh, well, this is in kids. But that's just not the case. It is that term comes from, okay, this was present since they were a child. So a lot of families on my page do struggle, and they're not able to get the services that they actually need. So it's honestly something that breaks my heart, and I've cried over, because I know that these parents need help, and I want to help so badly, but I know that there's only so much that I can do. But
yeah, no, it is heartbreaking. That's why I decided to create the WithMerci Foundation. It's one of my passions, one of my loves, and I don't experience, having somebody with a disability in my family. It's just what I studied in college and just fell in love with it. And the thing is like, you or I, Maya, and whoever else, we have to be able to band together in order to help a lot of families and all that. Heather, Chris, you guys are doing your part as far as educating everybody else. So it's a community thing. And the more that we can get people on board, the more we can push the power in order to bring these things to light for a lot of people in order to get behind our mission, our causes, donate more money. I mean, it's a lot of money going around in the U.S., especially during this pandemic time. So why not, for a lot of families with disabilities? That's what I'm saying.
And I know that it is a common misconception that if you have insurance will cover what you need. But there are very specific things that are urgently needed for kids, early and frequent. And speech therapy is a big one, that it doesn't just affect their speech. Speech is tied to your social skills and your social life. And so my daughter has apraxia as well, and her articulation is better, but she's always been very hesitant in her speech, and slower to be able to initiate conversations. And she didn't have a social delay, but her speech has caused social delays, because unfortunately, when you're a 3-year-old and you approach another 3 or 4-year-old and you want to speak, but it doesn't come out for a few seconds, that child either runs away or a lot of times thinks that you're somehow acting inappropriately. She got punched in the stomach more times than I can count by kids who just misunderstood that she was taking an extra few beats to try and speak. And so they thought that somehow she was posturing in a threatening way or something. And so then she became afraid of other kids. And, so there's so much more than just how you speak that's impacted by speech in your life. And so when I talk to people who say, well, insurance covers all these things, insurance a lot of times doesn't cover it. And in kids who have a condition that causes them to regress or develop very, very slowly, there are some medical conditions that cause you learn for a while and then you lose skills, whether from a neurological issue, seizures, or a mitochondrial disorder. It causes you to lose skills. Well, that can cause insurance then to deny your continued speech therapy, because they say, well, if you haven't made progress in the last 6 months, then it must not be working. And so that's another another roadblock.
It
Just
is.
why charities become so important.
Mm-hmm. Exactly. I'd like to get into this. How has it, I mean, we're talking about the financial burdens and all that, and I speak on this as well too, because we have to do the social distancing because of this pandemic. So how difficult has that become in your guys' daily lives?
It's been a lot. It's been a big shift. I felt like I was I did like a crash course in graduate school in like 3 days. Because I saw my last client on a Friday. On Monday, we were told we were closing the clinic. And by Wednesday, I was seeing kids. And I haven't done, now teletherapy's been around a while now, especially the service areas that aren't very populated, like rural areas, or it's been around a while, but regulation hasn't caught up to it, obviously. So for example, there's generally a speech therapy shortage. So you think, oh, we can do it virtually now. I can go work in New York if they need me, or California. But no, how things are set up, you have to be licensed in each individual state in order to practice. So anyway, these are just like information overload over 72 hours, and that's just adapting therapy. I have great parents like Heather, so it's made the transition a lot easier. But everyone's just had to adjust and be flexible. It's been amazing.
We figured out Zoom together.
Yeah, she helped me out. But another sad reality, unfortunately, is our company gets paid based off the services we provide. And if we don't provide services, we don't get paid, right? Mm-hmm. So like, I'm thankful for Heather and parents like her to even continue to participate in therapy, because I keep my job, because this has thrown everyone through a loop. No one was really prepared. And so, yeah, we're just trying to figure it out and keep moving as best as possible. Our families are going through a lot because they're also doing school and their job situation. And then if they're an essential worker, on top of still doing therapy. So it's just been a really tough time for everybody.
Yeah, it's been a heck of an adjustment for everybody. Interesting times we are in right now. Very unprecedented. Jordan, how has it affected you, this pandemic?
It's been weird, man. It's been a weird time because I was at college, I was taking classes, and then I just was told, oh, you can't come back to classes. And I'm like, oh, dang. Because I actually like going to classes and stuff. So it was weird for me to kind of make that transition with that part. And then also when we are talking about speech as well, as I also did have to do telegraphic speech as well, which was kind of hard to figure out at first. And I know that my SLPs as well were just as confused as I was, but we did end up making it work and such. We had around 4 or 5 sessions with it, so it did go well, but it is hard not having that actual face-to-face social interaction and stuff, because I feel like there's just so many more benefits and such from being face-to-face rather than having this over the phone or laptop thing. So
it is very difficult, not being able to be, because I'm a hands-on person as well too. I like the facial interaction. I like, if I'm in a classroom setting, I like to be able to sit there, be able to, after class, go up to the professor.
Talk, make notes.
Yeah.
I'm all for it. Yeah. I'm all for it.
Heather, Chris, how has this pandemic affected you as well?
You want to go first?
Yeah.
Go ahead.
Yeah.
So
Don't talk about baby. Don't take over.
The virus is going around and around and around.
This virus has been
And
around.
we stay at home because of the virus never died.
Mm-hmm.
Yeah, stay at home.
Yeah.
I want the virus to die.
We don't want that to happen.
No.
At all.
So
Stay safe.
in some ways it's made life a little simpler because we are doing telemedicine therapy and telemedicine appointments instead of driving across town. But at the same time, Christopher's social life has really narrowed considerably. So even though we homeschool, we interact with other kids all the time in the neighborhood and through a co-op and at church, and he gets together with friends, and he hasn't been able to do that. And obviously when you have a speech disorder, speaking on the phone can be really extra challenging. And so it's a lot harder for him to call friends to maintain that socialization. So yeah, I know he's especially been missing that social contact. Yeah. Although, what did you tell me about doing speech therapy on the computer?
It was fine.
It was fine. What else did you say? What do you think about doing speech therapy on the computer?
Very cool.
Yeah, it is kind of cool, huh?
Kind of cool.
Yeah.
It's kind of cool.
Christopher likes anything to do with computers, and
Yeah.
Before we wrap up our hour right here, let me just ask, what can we do from all of you? What can we do in order to help those with, apraxia to continue to push the message, even right now in this time? What can we do?
well, I'm going to give a huge plug to Easterseals because I think they are such a phenomenal group. The therapists there are extraordinary. They're constantly looking for new ways to educate themselves, and I know they don't get paid as much as they would if they worked elsewhere for a private company. But man, they are so devoted to their clients, and they provide the best therapy. I mean, we could get therapy in home a couple of times a week, and I won't do it because I'd much rather drive across town to go to therapy in the office and see these amazing therapists. They are just we've had so many doctors be completely blown away by the progress that our kids have made because of them. So
There's a lot of stuff. There's a lot of stuff that I could say. I guess one of the main things is just letting people, I guess that one of the main things is honestly just letting everybody know that everyone's different in their own way. Not everybody's the same. Every single person goes through different struggles and such, and apraxia just happens to be one of mine. And just honestly letting people know, because it's not very well known at all, and there's so many different misconceptions and such. So if we can just give people the right information and just letting people know, I feel like we can get a long ways just with that. But it's actually apraxia wasn't recognized by ASHA until 2007. So we are talking about just 13 years back. So it is my hope, and my goal is just to let every single person know and go as far as I can.
Jordan brings up a great point about ASHA. ASHA is who's certified speech language pathologist, and because childhood apraxia has just changed, or we're getting a better idea about it. So overall, the point is, I'm glad there's people like you bringing awareness, because that, at the end of the day, the more we're aware, the more we're knowledgeable about it, then hopefully we can get better research and better treatment. But if no one knows it's out there, or that this is a concern, it's hard to get things done. So the more the squeaky wheel gets the oil. So the more people hear about it, the more we know it's present. Hopefully, just better education, better services. And I think, once again, to Jordan and Heather's point, just empathy. We aren't very, we don't extend a lot of grace, right? So more patient we are with people and don't necessarily jump to conclusions too quickly. We do ourselves and them a disservice. So, yeah.
Yeah, agree.
Thank you. We appreciate you being a voice.
I know. I appreciate it. It's very humbling. I learned a lot from you guys today, especially. I research a lot of, disabilities that really not heard of disabilities. I know that's bad wording to put that, but really things that aren't really being talked about in a lot of families that are, struggling with the rarity of some of these disabilities. And so we like to put those to the forefront. Not the sexy ones that everybody want to go for, as far as they go. And so, we're in this fight with you guys. Thank you so much for joining me and just being here in order to educate so many people, especially during this time, this month as well too. So this is one step forward to educate so many people out there. And so hopefully we bring in a lot more people just based off of this interview right here.